Hello everyone, welcome back to another class with Dr. Garima. Today we'll be studying a very important topic, that is wound healing, right? Now what exactly is a wound? A wound is a break in the integrity of skin or tissue caused by injury or operation. तो कोई भी injury हुई, suppose you get an injury while cutting an apple. While cutting an apple with the help of a knife, you get an injury or a break in the integrity of the skin of your hand. You get a cut in your hand while working with a knife. That is a wound, right? What will your body try to do? It will try to heal your wound. So healing is the body's response to injury in order to restore the normal structure and function. So what your body is trying to do, that is trying to restore the original structure and the function which was present just before the injury, right? That is your body response, which is called as healing. So you understand what is wound and healing. Now your body can respond by healing in two forms. One is regeneration, second is repair. Now it is important to understand that what difference is there between the two. Regeneration is complete restoration of the normal structure and function. That means पूरा का पूरा regenerate हो गया है. Suppose liver injury हुई, liver में stem cells है, उसने अपने आप को पूरा regenerate कर दिया है without any scar formation. Without any scar, that is important, right? Without any scar is regeneration, and this regeneration occurs with the regeneration of the same type of cells as the organ which has undergone injury, right? So no scar. Whereas repair is also trying to restore your normal structure but cannot do it up to 100%, not 100% healing. Why? Because some scar has been left behind. So we say sometimes some things are not completely regenerable, right? They are not completely regenerative. There is a formation of scar, and when some scar has already resulted, it cannot be 100% as a normal structure and function. So repair is not a 100% healing because there has resulted in the formation of a scar, whereas regeneration is the complete restoration because no scar is there, right? And second, the regeneration occurs with the help of the same type of the cells as the tissue which has undergone injury, right? Next, stages of wound healing. Now in order to understand the concept of wound healing, we will again come to the same example that you are trying to cut an apple with the help of a knife and there is a cut in your hand. So what will your body try to do? What will be the first thing that will be seen? There will be seen some amount of blood. There will be seen some amount of blood, and your body will try to stop that bleeding so that your body does not lose out on any further blood, right? So hemostasis is the first thing your body will try to do. In fact, you will also try to compress that wound with the help of a clean cotton present anywhere near you, so that you do not lose out on any blood. So your body knows that the first important thing at that point of time is to stop bleeding, right? Is to stop any further loss of blood. So what will be happening is platelets will come to the site of injury. So platelet adhesion, right, followed by their aggregation. So platelets will aggregate, upon which there will be fibrin deposition, and finally a blood clot will be formed. So that is the maintenance of hemostasis. We have already studied about the concept of hemostasis, so we know that that is the first priority of our body. Now this blood clot will act as a scaffold, right? It will attract various inflammatory cells. Now what is the second priority of your body? It will try to prevent any infection, right? Your body will try to prevent any infection at the site of injury. So that is your influx of inflammatory cells. Now what are those inflammatory cells? First inflammatory cell will be neutrophil. Now we have already studied about why do neutrophils come first to the site of injury. First, because they are most numerous, right? They are most numerous leukocytes in your blood, right? Second, they have very high affinity towards the receptors on the endothelium, and they easily undergo diapetesis and come to the site of action, right? So neutrophils will be the first inflammatory cells to reach to the site of infection, to the site of injury, and their function will be first to prevent any infection. They will prevent any infection from any organism, because now due to injury to your hand is now exposed your interior body is now exposed to presence of any bacteria or any viral or any basically infection present around. So basically most important will be bacterial infection, and your body will try to prevent any occurrence of infection. So neutrophils will prevent any infection, especially bacterial infection. And second, they will also digest any dead cells present there with the help of secretion of various proteolytic enzymes. So what they are trying to do, they are preventing any infection and also clearing up any debris present at that site. Now once you clear out any infection or any dead cells present at that site, second thing your body will try to do is to now it wants to restore its normal architecture and function. How will it do that? Any breakage in the epithelium, your body will try to re-epithelize. That means there will be some epithelial spurs which will try to restore this normal epithelial architecture. Next will be formation of granulation tissue. Now what is granulation tissue? Comprises of three things: fibroblast, inflammatory cells and blood vessels. These three things comprise of this granulation tissue. Why is it called granulation tissue? Because of this typical fleshy appearance, it is called as a granulation tissue. Do not get confused between granulation and tissue and granuloma, right? What is granulation tissue? Comprising of fibroblasts, inflammatory cells and small blood vessels at the site of injury. Now, then maturation component. What happens in maturation? There is wound contraction. Now tell me, if when we'll be studying further about the concept of primary and secondary healing, we will understand that wound contraction is a main mechanism, especially in the process of healing by secondary intention, because in secondary intention the injury is the defect is large and thus we need to contract the wound, whereas in primary healing the injury is very small, the defect is small and it doesn't need much of contraction. Only re-epithelialization or epithelial spurs are enough, to close the wound, whereas in secondary intention the defect is very large and you need contraction of the wound. So wound contraction plays an important role in the secondary intention. Now remodeling of connective tissue. Now what exactly is remodeling of connective tissue? You know, there are number of components which result in the formation, in the deposition of collagen and scar formation and thus try to heal the injury, right? So you understand the stages: inflammation comprising of blood clot, influx of inflammatory cells, followed by re-epithelialization and granulation tissue formation. Again, granulation tissue will be more in secondary intention healing because the defect is larger, right? Now wound contraction, again secondary healing, and remodeling of connective tissue or scar formation, right? Now features of wound. First I told you presence of blood clot. What will happen? Platelets will come, okay, they will adhere and aggregate, and along with the fibrin deposition your body will try to maintain homeostasis or stop any further bleeding, and blood clot is the first thing to see on day 0, followed by the presence of neutrophils, which are the first one to enter the site and they enter as soon as the day 1, right? Day 2 there will be epithelial spur or re-epithelialization. Day 3 macrophages will replace the neutrophils and the appearance of granulation tissue will start. Day 5 abundant granulation tissue, especially in the secondary healing or larger deficit, right? Neovascularization is maximum on day 5, it is an important question, and full epithelial thickness will try to restore. End of second week there will be remodeling of connective tissue, deposition of collagen. By 1 month there will be a good collagenization or scar formation, right? And the collagen type 3 will be replaced with collagen 1. If you remember, 1 should be the strongest, so it has greater tensile strength and thus will try to maintain a good wound healing architecture. Right, so healing by first intention and second intention, I told you, if you compare the deficit, here the second intention will occur when there is a larger defect. Whenever there is a larger defect, there will be larger clot, right? Dehydration of the surface clot will result in the formation of scab, which will act as the scaffold for various inflammatory cells. Where will be inflammation more? Secondary intention, the deficit is larger and thus more inflammation, more necrotic debris and more fibrin to remove with the help of these neutrophils and inflammatory cells, right? Larger amount of granulation tissue should be present at the site. Wound contraction is again an important feature of secondary intention because the deficit is larger and contraction of the wound is required compared to the first intention where simply epithelial spurs can restore the architecture. So is it clear? Healing by first intention and second intention, right? So healing by first or primary intention involves injury of a less deficit, like smaller deficit I can say. So superficial wounds I can say, example surgical sutures. The surgical sutures which are done are usually smaller deficit and thus they are cleaner wounds with less incidence of infections, and less granulation tissue. Whereas in healing by secondary intention, for example, bed sore, diabetic ulcer, large size ulcers, there are larger deficits and wound contraction is required too because the deficit is such large in size that wound contraction with the help of myofibroblasts is required to restore the or to lessen the size of the deficit. So larger amount of granulation tissue, more necrosis, more inflammatory cells I can say, more inflammatory cells in secondary intention, right? What is granulation tissue? See, these are the blood vessels, right? Myofibroblast or fibroblast will be there, inflammatory cells will be there. So three components are there making up the granulation tissue. Again, more in case of secondary intention healing, right? Wound strength is 10% after 1 week. It increases during the next 4 weeks and becomes almost 70% till the end of the 3rd month. And it keeps on increasing as the time progresses, but it will never reach 100%. The wound strength cannot reach 100%, but yes, it keeps increasing with the time and almost 70% by the end of the 3rd month. Important question. Now, vitamin C is again important vitamin required in wound healing. Again, important question. How does it do this function? It is required for conversion of tropocollagen to collagen, which provides strength to the scar due to hydroxylation of lysine and proline residues, right? Predominant collagen in adult skin is type 1, whereas in granulation tissue it is type 3. Now, I told you that regeneration is complete restoration, no scar, repair, there is scar formation, so not 100%. Okay, so it will occur in deeper wounds because some scar has to be there in deeper wounds. Now, persistent tissue damage will result in the larger size scar or fibrosis, example in chronic conditions, chronic inflammation. Next, scar formation, what will happen when tissue injury is there, inflammatory cells are there, granulation tissue is there, later there is extracellular matrix deposition. These things are occurring in the maturation phase and remodeling of fibrous tissue which matures and reorganizes and results in the formation of scar, and repair is the process where the healing occurs along with the resultant scar formation. Now, what is the role of myofibroblasts? It is a special type of organized type of fibroblast which has got various functions. One is wound contraction because it has got contractile ability, wound contraction. Also, it has higher levels of extracellular matrix deposition and thus plays important role in the maturation phase of wound healing, right? Next, complications during wound healing, delayed wound healing, why will it occur? For example, infections, foreign body, right, malnutrition, these are all important reasons for delayed wound healing. Deficient scar formation, excess formation of repair components, right, formation of contractures due to various scar resulting fibrosis, right. Right. So last will be difference between hypertrophic scar and keloid. Now, keloid is this when the scar grows beyond the original confines, right? It is much more area involved in case of keloid. So scar grows beyond the original confines of the wound, right? Whereas in hypertrophic scar, it is confined to the confined, it remains within the confines of the wound, right? It develops after 3 months of injury within 4 weeks after trauma. Now, it is very important, the most common site of keloid formation is sternum and the treatment is intralesional steroids, right? So, you understand what are the steps of wound healing, right? And you understand various important MCQs in the concept of wound healing. So, I hope you like the video, and if you like the video, then please don't forget to hit the subscribe button and don't forget to press the bell icon. Thank you.